My name is Kiston Palmore. I'm the Franklin County Reentry Coalition Coordinator, and I will be your moderator for today's panel on creating safe and productive communities. Before we begin, I want to thank NBC Leo for including this critically important topic of reentry on the conference agenda. Reentry affects every community. In Ohio, the number of people going to prison has increased more than 400% over the past 35 years, with women being the fastest growing population of those incarcerated. Of the 6.8 million Americans incarcerated across the nation, more than 50% of all incarcerated individuals suffer from mental illness and co-occurring substance abuse. Our county jails have become the de facto mental health hospitals and crisis center of last resort. Currently in Ohio is facing a heroin epidemic. In 2015, 2,744 people died of drug overdoses. The Federal Centers for Disease and Control and Prevention reported that in 2014, 28,000 people died of overdoses nationwide. One estimate is that nearly 2 million Americans are addicted to heroin and opiates. This crisis has spurred a shift in public policy and sentencing in Ohio from the emphasis on punishment over treatment. In recognition of the concurrence of mental illness and substance abuse, Franklin County became one of the initial counties in the nation to launch the Stepping Up initiative. The goal of the initiative is to improve public safety and public health outcomes from people with mental health and substance abuse disorders in the criminal justice system. Nationally, more than 95% of incarcerated individuals, or more than 650,000 people each year, return to the communities. When individuals are released from incarceration, the communities to which they return have a vested interest in assisting our residents in reuniting with their families and obtaining valuable supportive services for a stable and productive life. I am honored to be joined by a panel of policymakers and advocates who are committed to developing pathways to successful reintegration and to offer insight into increasing public safety by creating valuable supportive services for stable and productive lives. Here on the panel are Franklin County Commissioner Marilyn Brown and the chair of our Reentry Coalition, and City Council Member Mitchell Brown, CEO and President of Alvis, Denise Robinson, and the Franklin County Sheriff's Office, Captain Michael Turner. Because their bios are in your bulletin, we will not read them in the interest of time, and I will leave the podium to Commissioner Brown.
Thank you. And I would like to give a shout out to our Councilwoman from Columbus and Council President Pro Tem Priscilla Tyson in the front row. Thank you for the invitation to be here today and for putting this together with all of your colleagues from around the country. The issues we're going to be talking about, as you all know, are front of mind for so many of us. And what I'm going to talk about for just a few minutes is the issue of leadership needed to really get into making differences in the lives of all of our residents. So I want to talk a little bit about what we do in my office in Franklin County and why we do it. We're talking about first costs, and we're talking about the costs of incarceration. I'm sure most of you are well aware that the costs of incarceration far surpass what we do in providing funds for education, providing funds for almost anything else we do in your local governments. But it's really also the costs of what we do with our families of those who are incarcerated. Incarceration affects more than those that are incarcerated. It affects the children, the moms, the dads that are not incarcerated. Their lives are changed forever. And we take that into consideration in my office, and we take that in consideration as we look at the 6,000 children that are affected each year in Franklin County, those children that don't have one parent with them because they've been incarcerated. So the costs are huge. And we also look at, conservatively, $329 million lost annually from those who are incarcerated and not working in the community. And that's really a conservative estimation. So what returning residents need? We ask the question all the time of our returning residents. When I go and speak in the prisons and in our jail, what do you need? It's really no different than what any other resident needs. A champion in leadership at the city, county, state, federal level is really important to advocate for policy changes, for services, and for opportunities for people. But you also need the coalitions to be formed to really get things done. We have our reentry coalition, and you'll see in a couple slides later what that reentry coalition consists of. But what people really need is a strong constituent service program so that people know what's really available. And it can't be done. Constituent services, we say in our office, we serve 1.2 million people, one resident at a time, because what one person needs is not anything alike what somebody else needs. And you have to take everybody's needs into consideration when you're talking about constituent services. So you look at this chart. By going to visit incarcerated Franklin County residents in the prisons and looking at pre-release and encouragement and contact in my office, we're going to look at a couple of things that happen. This chart shows this chart shows the national recidivism rate at 43%. If you could click that. We then get to the Ohio recidivism rate, which is 27.5%. Click again. We get to Franklin County's recidivism rate, which is about 27%. So you see we're getting better and better. And if you click one more time. My office's recidivism rate in working with reentry residents is 3%. Now, granted, I will be the first to admit, the people that contact my office do so after we go out to the prisons, talk about the things that we have to offer. We say we have a myriad services, job and family services. We can help get them to transportation. We can help with job services. We can help reduce as many barriers as you could imagine any returning resident has. We can get them into job training. We can do anything that you could imagine. And that's going to be about 20% of what they're going to need. The rest is up to them to follow through. We'll even give them contacts of names of people to talk to, not just an agency referral. We have developed contacts of the people who we know we can count on to help them get to the service they need. However, we know this 3% reduction, or recidivism rate, is a self-selected group of people that contact us. It's still 3% versus 27%. And it's hundreds of people that have contacted my office and gotten services from my staff. And it takes a committed customer service team talking with our restored and returning residents who say to people, you are the constituents of my commissioner and this office. When you come back, you are our constituents, and you deserve no less, no more than anybody else. And it means so much. So, you will see on this slide, champion leadership makes a difference. But champion leadership alone isn't enough. I do have a cape and tiara in my office. I really do. It was given to me as a gift, and I have not changed the world yet, because I alone can't do that. We all have to do that. With the work of our reentry coalition led by Kristen Palmer, our moderator, we have managed to do an incredible job working with city and county agencies, working with Denise Robinson, and you'll hear more from Denise from Alvis House. We have made incredible strides at getting people from being those folks who nobody wants to hire to being the best workers ever in our county. So you'll see on the next slide the members of our coalition. You may not be able to read them all because there's so many, but I will tell you, we had our meeting yesterday. We had standing room only at our reentry coalition, and we had more engagement and talking than I have heard at any reentry coalition meeting in the 4 years that I've been chairing this coalition. There's more active work going on in Franklin County right now than I have seen and heard in a lot of years, so I'm thrilled with that. We do all of this direct service by serving our residents, and you can go to the next slide just for 1 second. By serving our residents one at a time. And if you go to the next slide, I want to tell a story before I end. This is a story about 2 of our employees. It's the story of Chad and Vernon. One of these guys has a mom who just recently died, a prolonged death to cancer, a brother who's a heroin addict, and in and out of jail and prison and the hospitals, always, a girlfriend who recently left him. He never graduated high school. He lives paycheck to paycheck. He has not accumulated vacation time. He's not accumulated any sick time due to all the multiple emergencies of his family. He's had issue after issue after issue. He's had emergency after emergency. He's one of our landscapers at the county, and he's an awesome employee. The other of these guys has a high school education, studied and passed his exams for herbicides, insecticides. He's a proud father and grandfather who has had health care now for the first time in his life, now that he works for Franklin County. He has a savings account. He has a retirement plan. He's also an awesome landscaper for us at the county for the last 4 years. He also has 20 misdemeanors and felony arrests. And he had been in prison more than 20 years before he started working with us in Franklin County. I don't know if you could guess who is who, but I'm here to tell you that both Chad and Vernon are the best employees that we have doing landscaping in Franklin County. And Vernon, who has the criminal involvement, is so thankful to have the job. And he and Chad both are the most exemplary employees that we have. One with the criminal involvement, one without. You would not know the difference in their work ethic. You would not know the difference in their work on any day. They're both there. They're dependable employees, and we're thrilled that we have them. So in Philadelphia, in my closing remarks, I want to just show you this. In Philadelphia stands a masterwork called Freedom. The artist created it around our universal need to break free of any situation, struggle, or circumstance. It's fitting that we here today get inspiration from this artwork. It's an incredible piece. And share the ideas here that you're getting this few days that you're in this conference, and from this panel especially, on how to free our residents from generations of poverty, unemployment, incarceration, and all the barriers that ensues when one person in a family is incarcerated. A whole family suffers the effects. I'm here to tell you today, we must break the stigmas from incarceration and free families, and make sure we give all families opportunities to succeed. And I want to thank you again. I look forward to hearing my fellow panelists, and thank you for listening.
Okay. My circumstance is a little bit different. The country in general, and Central Ohio specifically, is experiencing an opiate epidemic crisis of unparalleled proportion. Drug usage and overdoses are on the rise. In 2013, Ohio experienced the highest number of overdose deaths on record. Heroin-related deaths surpassed prescription opiate unintentional drug overdoses. I'll be throwing out some numbers, but I'll accentuate those that I think are really, really important. In 2014, with more than 2,500 unintentional drug overdoses, the Center for Disease Control ranked Ohio second highest in the number of drug overdoses and deaths in the country. In the country. I mean, I bragged earlier about how great Columbus was, but guess what? I don't want to be high in this number, in this category. Franklin County in 2014 saw a 227% increase in the number of deaths resulting from unintentional drug overdoses since 2003. In the 60s and 70s, heroin was the scourge, if you will, of the urban poor. Over the past decade, the abuse of heroin has migrated from low-income urban areas with large minority populations to more affluent suburban and rural areas with primarily white populations. The face of heroin today is a white male or female, the average age of 23. What's scary about this, and my own personal engagement, in the early 70s, when I was involved in emergency medical services, and it wasn't even called that in the early 70s in Pittsburgh, in the inner city of Pittsburgh, the Hill District, there was a group called Freedom House. We were involved in emergency medical services. People in the Hill District, it was African American, were dying at an alarming rate from drug overdoses. I happened to be one of the paramedics at the time that was engaged in the use of Narcan almost 40 years ago. 40 years ago. What was significant about that is that people in the Hill District who were engaged in opiate overdoses were surviving. We were saving their lives. The other individuals and other communities who were involved in opiate overdoses were dying. It was, at that particular time, if you've ever seen the movie American Gangster, it was all about the drugs coming from New York and how it spread out through our communities. Well, I got to tell you, folks, we're right back at that same situation again in our communities. The heroin of today is not the white powdery substance of yesterday. The heroin of today is commonly known as black tar heroin. It's a sticky, dark substance. I have a book here to show you if you want to take a look and see. It is a semi-processed heroin that comes from Mexico, and it contains a lot of impurities, which adds to the fact that when you inject it, you don't know exactly what you're taking. 90% of the people who are using heroin today first started out with prescription opioids, like Oxycontin. The cost and accessibility are the main reasons why people try heroin in the first place. But the drug strength causes many to stay with it. In an effort to address this epidemic, the city of Columbus is taking a multi-front attack on how we deal with opioid addiction. Narcan, as is commonly known, as the actual medical name is naloxone, can be used as a lifesaver. Narcan gives those who are addicted to heroin an opportunity to recover from their addiction. Basically what it does, when you give an injection of Narcan, and what we're doing here in Ohio, as I talk about with our police, is it's injected through a nasal spray. And it's very easy to inject. And what it does is it helps address the issue of the receptors for respiratory activity when someone injects heroin. It's complicated from the standpoint of being available to address the problem when it happens. If you're not there when someone is injecting heroin, chances are they're not going to make it. Narcan, again, was administered back in, like I said, we started it back in 1972. It's an amazing circumstance that we've come so far and how we deal with that. Our EMS units, our fire division personnel, address on a daily basis 5 to 7 drug overdoses every single day. 5 to 7. That's a lot of folks. When you add up the numbers, it comes out to a little better than 2,200, depending on how you do the math, on an annual basis. That is just absolutely unacceptable. And that's our EMS response, let alone those that we don't know about, and one of the other areas we've been trying to deal with. The Columbus Division of Fire began maintaining statistics of heroin overdoses and the locations in our city. When they mapped the statistics, clearly identified what we call hot zones. It's an area where we looked at the zip codes to determine where are these things happening with the degree of frequency, and how can we impact that as best as possible. That was our EMS people. What we did was, when I became a council member back in February this year, I got a chance to meet with my dear friend Priscilla Tyson, and we talked about this. And she was telling me, okay, the police are kind of involved, I was referred to as director, but they're not, I don't know how to make this happen. I got the police together, I got the fire division together, and told them, police, you're going to do this. So, they initiated a pilot project in May of this year, and I got the statistics just today, and only in certain locations are we doing this. 14 people's lives have been saved by our police. 14. Simply because they were there. Not because someone called them to respond, they were there when the situation took place. They were able to administer the Narcan and then subsequently call EMS. And we have a very good EMS system, and our response time is anywhere between 4 to 6 minutes. But in those 4 to 6 minutes, when you're involved in a respiratory overdose, that's precious time. So we're making a difference from that standpoint. And I have one police officer who has administered Narcan 5 times himself. This guy is off the charts. He's so happy, he don't know what to do with himself. He just thinks, I think he might leave police and go over to the fire division, because he's doing what police officers do, which is save lives as well. You know, we hear all this other stuff about the cops, but I got to tell you, as you already heard when the president made the comments earlier this morning about in Dallas. We ask them to do a lot of things, or I ask them to do one more. And they're taking on that responsibility and doing it very, very well. As we continue to address the issue of the hot zones, we also had to spend time with the Columbus Department of Health. The overall goal there was the programs were to lessen the tragic impact of addiction of heroin and opiates and saving lives, helping people recover, and stopping the spread of this disease. The Columbus Health Department developed and launched a community-wide program called Harm Reduction Program in partnership with Caucus Health. The program is called SafePoint. I'm going to run through this so you get some appreciation for what they do. SafePoint includes intervention assessment, treatment, counseling, testing for HIV and hepatitis C, and a linkage to treatment with regards to syringe access to reduce the spread of infectious disease, and also the dispensing of Narcan to at-risk individuals to support their families and their friends. Through 25 community sites, our Columbus Public Health provides education, case investigation, case management, and referrals for clients at risk to link them to definitive medical care and other social services. It's important to understand this is an addiction. This is a disease. It's not something criminal in that respect, but it goes on to other elements that have an impact with regards to criminal activity. The Columbus Health Department has established an opiate crisis phone line to better connect callers with opiate prevention and treatment resources. Our Columbus Public Health has stocked Narcan in all of its clinical areas in the event that a client would need or had an overdose while in their involvement. The Columbus Public Health is partnering with our Columbus Division of Fire and EMS, and now also with our Police Division, to establish home visiting and outreach for individuals who have been involved in receiving Narcan more than once. I don't want police officers playing the role of social worker in that respect. They do what they do. If it occurs more than once with the same person, as we have had one case right now where that has happened, pass that information on to our health department and let them deal with it from that perspective so that they can try to get this person some additional help. Most recently, when we start talking about treatment, the Columbus City Council unanimously passed an ordinance providing Alvis with $250,000 to renovate a former physician's office on the Near East Side to help with the issue of treatment. That's part of the whole deal involving substance abuse. When you get into the issue about the impact of what you can do to make a difference, the National Institute of Drug Abuse and the Surgeon General's office, and these numbers are special, estimate that illegal drug use costs society $181 billion a year. Combined expenditures for health care, enforcement of drug laws, crimes committed by addicts and abusers, lost productivity, jail and prison facilities for drug offenders. $181 billion a year. That's such an incredible number, right? When you think in terms of, most sheriff's departments will tell you, as well as law enforcement, 50% now of the number of women incarcerated across the state between 2013 and 2014 to heroin abuse and addiction. More women are being engaged in this problem. We have to be aware of that. And as a result of that, you have what is known as the domino effect on families, as you already heard from Commissioner Brown. It doesn't just affect one person. If somebody's doing drugs, it affects that entire household. And that means it has an impact on everybody. When you think in terms of lost work and all the other things associated with it. So it creates a domino effect. Franklin County foster care cases with parents dealing with drug abuse issues increased. In 2014, the number has risen over 13%. It was 9% in 2010. It's now up to over 13%. It has this kind of an impact for all of us. The number of drug-dependent babies. One of those 14 cases I was telling you about with our police involved a mother who was on heroin, and it impacted the baby. And the police officer was able to do what it happened to be he at the time, dress the baby and the mom, call EMS, and save the child as well as the mom. It's special stuff. That is absolutely special stuff. In closing, what's significant to keep in perspective has to deal with the issue of treatment. It has been determined that treatment costs effectively. Every dollar invested in addiction treatment programs yields a return between $4 and $7 in reduced drug-related crime, criminal justice costs, and theft. When savings related to health care are included, total savings can exceed costs by a ratio of 12 to 1. I don't have the solution for how to deal with the opioid crisis that we have in our society, but those who do have a problem, we ought to at least make certain that we have treatment facilities that can help them and be prepared to help their respective families. Thank you.
Good afternoon. Good afternoon. How's everyone? Well. Good. I'm really excited to be here. Thank you so much. I came from the airport. I was in Dallas all week at another it was the National Association of Blacks in Criminal Justice. And I actually took my son with me. He was with me at the luncheon today. And I took him with me because he's on break from college, but that was number one. But number two is I wanted him to be able to see what I do and what we do for the community and for others. And secondly, I wanted him to see this too, because it was a continuation of my past week. So I'm really thankful for that. He's a 19-year-old black man, and we know that there's issues surrounding that. And I'm continually telling him what to do, what to say. My husband does the same thing all the time. And it was ironic that one of the workshops, and I enrolled him in this conference in Dallas, and it was, what do you do when you get stopped by the cops? And he says, oh, Mom, I don't want to go to that because you and Dad say that every day. And I was like, well, we have to say that every day. I also am pleased to be here with my colleagues here that our Franklin County Reentry Coalition. I was lucky enough to be there in the very beginning. And if you saw the list of partners there, and there's a lot of folks that are really working towards making families whole again. So thank you, Priscilla, for having me. And I just wanted to quickly, before I get into my notes, and I'll be brief, but I never thought I would be in the criminal justice field. My father was a policeman. My grandfather was a policeman. My grandfather was a policeman when you could not arrest a white person. He could only arrest blacks, and this was in the 30s and 40s. And they had to detain them while another police officer ran to get a white officer to arrest a white man. My father was a captain of our police force, and actually I grew up near Pittsburgh. so that's interesting, so I know exactly what you're talking about. But when I was a senior in high school, my father shot and killed one of my classmates. And I had an aversion to offenders, and I do not ever want to be around those people because my life was threatened. I had to go to school my senior year with armed guards that were in our front yard, our backyard, at the end of every hallway in my school. And I said, I will never work with those people. Well, once I realized it's not those people, people are people. And that's one of the things that I do in my organization. I have 44 locations in the state of Ohio. I have 500 staff. And one thing that I always do when we have new hires orientation is I always tell them, people are people. I don't care what they've done, but if you forget that they're people, then this is not the place for you to work. Because people need to be treated as you want to be treated. I also tell them, if you lie, you need to leave because we can fix a mistake, but we can't fix a lie. And I say all those things because if you're going to work with the population that we work with, you've got to know that they are people and you've got to treat them as such. I'm really delighted to be here today just to talk about the good work that I do, and that the staff that work at Albus, we are amazing. That's number one. But number two is Our Franklin County is an amazing place to be, and it's an amazing place to work. We are a model for the nation. And not only nationally, but also internationally. We are called upon numerous times to help people, number one, start programs such as ALVIS, but also all of the things like the Stepping Up Initiative, like the street drugs that we're talking about. When Michael starts talking, you'll hear all about those kinds of things too. We are a model, and I'm so thankful that you all are here in Columbus, because this is where it starts. This is where it happens. We can go anywhere in this country and someone's talking about, hey, can you come help us start those kinds of programs? Commissioner Brown talked about recidivism, and I'm real pleased to say that my organization, which is Residential Community Corrections, we have 44 locations, as I said. People come directly from prisons, federal prisons, from state prisons, from county jails, directly sentenced by judges. We have a lot of specialty courts. I think you heard about that this morning, where people come directly from those courts also to our organization. And we talk about recidivism. You know, there's a lot of definitions about recidivism, but I never like to talk about a one-year recidivism. My organization talks about 3-year recidivism. 79% of the people that go through our programs do not recidivate. They do not return after 3 years of graduating from our program. And I love standing on the mountaintop and saying that, because 79% of the thousands and thousands of people that go through our programs are successful. When a person, you know, I always use this quote that it's like incarceration, it's like a stone thrown into a pond. The effects of an individual's incarceration radiates outward. And it radiates outward to families, out to communities, the children. You know, those are the silent victims of crime. And I'm going to get to that in just a minute. But, you know, the vast majority of offenders, 80%, have a substance abuse issue. And you just heard Commissioner Brown talk, Councilman Brown. They're brothers and sisters. So I get them mixed up all the time. In Ohio, 41% of the folks that are going to be released from prison 1 year, 41% of everyone in Ohio prison gets released within 1 year. Our Ohio prisons, we have about 55,000 in our prisons, and 41% of them are going to get out in a year. So our challenge is why? Why send them to prison for less than a year? Shouldn't they be in community programs like mine? Shouldn't they get the services that they need to be successful? Shouldn't they be able to get jobs? Shouldn't they be able to take care of their substance abuse? Why are you locking them up? Well, some of the conversations that we have sometime is that by the time they are processed, assessed, locked up, it's time to start your reentry plan. Well, what sense does that make when you didn't even have to go in there? You could have been stopped before you got into prison. So let me just tell you a little bit about community corrections programs as a whole. There's a lot of them all over the country. They include, but are not limited to, residential community corrections, outpatient, and less commonly known as residential substance abuse and mental health treatment. We have day treatment, which includes like job readiness programs, cognitive behavioral treatment, outpatient services, substance abuse testing, and community service. It is imperative that our clients give back by completing community service. They got to give back to neighborhoods. You can see anytime, you know, one of the things I always used to say in my organization is I don't want to see our clients picking up trash. And people would say, well, why not? You know, why wouldn't they pick up trash? Because there's a lot more meaningful things for them to do. That's why. You know, they don't need to always be picking up trash. I drive down a freeway and I see folks picking up trash along the freeway. I'm like, wow, how much more can you degrade people? Why can't that be a job that you're paying them to do? So, I mean, I can get on the soapbox about that, and I won't, though. Work release. We do a lot of work release programs where they come to us with jobs, and the judge said, hey, you're going to go spend some time at ALVIS in a work release program so that they can maintain their jobs. Part of our job is to also continue to educate the judiciary. You know, they don't always have to go to prison, you know. it's just, I don't know, it's just always one of those things. Don't lose their job. You know how hard it is to get a job? Why would you not, have them lose their job? A lot of GED programs, a lot of our clients have never completed their GEDs, so it's really hard to get a job without a GED. We also do GPS monitoring where we can see where individuals are all the time. Also, I'm not sure if anyone has ever heard about, it's called SCRAM, but it also monitors your blood alcohol level as a ankle bracelet, so there's a lot of technology that comes about. Research. One of the things I made a decision about 17 years ago, 17, 18, 19 years ago. I made a decision we weren't going to do any programs that weren't based on research. The reason why I did that is because I think that we waste people's time, we waste our staff time, we waste our clients' time if we're not going to be successful. If there's no research that we can find out there based on a program, then we create that curriculum and have that program researched ourselves. We have licensed psychologists and independent social workers and any kind of counselor you can think of. We can do the research with our local universities ourselves because we don't want to waste time. There's no time to waste. They've already had enough time. We have no more time to waste. Partnerships, that's one of the things why the Reentry Coalition was developed. And as Kristen said, we were one of the first in the country to develop a reentry coalition, but you got to have those partnerships. I used to function on Alvis can do it all. We're just specialists, we can do it all. And then one day it was like a aha moment that we can't do it all, and the partnerships are what's really, really important. Is working with other folks. There's other people that have specialties, and we need to use those folks and use those stakeholders and those partnerships. Professional and credential staff at Alvis. It's a requirement. You have to be credentialed. You have to be, licensed to provide some of the programs that we want provided. Of course, there's other positions that don't require those, but I think when you require some of those things, sometimes what you get is a more professional staff, and you're able to help people also to continue their education too by going through our programs. Individual assessments. One of the things that we found that is very effective, and it's based on the research, is so many times that people program people the same way, the exact same way. This is our male program, this is our female program, this is our kids program. Well, no. Everyone's different. Just like we're all different, so are our clients that come through our programs. They're very different. They have very different needs. They have very different risk of reoffending, so we make sure that those individual assessments are done and everyone gets an individual program plan. And again, that will include all of those things that I talked about earlier. We know effective programs prevent crime. We know that. The data shows that. I'm a little data freak, like Gloria that's sitting over here. She's a little data freak. And, just like to look at the data, because if you're not looking at the data, you'll never know if you're successful or not. So some people might look at some of the lists of program components and think it's soft on crime. We're never soft on crime. We don't have time to be soft on crime. What we want to do is hold people accountable. Hold people accountable for what they did, number one, but number two is hold them accountable for becoming whole and making that community whole again. I talked a little bit about, I know some of you've heard about tent cities, the tent cities out in, when you think about that, what is that teaching anyone? It's not teaching anyone anything, so we gotta have a lot of programs for our clients to go through. There's a lot of data. You already mentioned the national recidivism data, so I won't go back over that again. But I'm really proud of my organization. We will celebrate 50 years next year, and as Priscilla so noted this morning, is that I've been with the organization for 32 years, and I was 12 when I started. But when I started, we had 3 facilities, which were houses, which you usually associate that with halfway houses. My organization was Alvis House until October of last year, where we dropped our house because we outgrew our house. We have 44 locations, as I said before, but also they're large facilities and they're not houses. Our females are in houses. As Commissioner Brown said, the female population is the fastest growing population in the country that is in the criminal justice system, all related to drugs. And then again, I need to talk about quickly I want to transition to family. I mentioned earlier about the silent victim. The silent victims are the children of our clients, people that have been through the criminal justice system. What we don't want to see is them in our facilities. So we had to develop programs to work with our families and with our children. You know, one of the worst things that could ever happen is that a woman goes through one of our programs, and the day that she graduates, she is handed 3 children. 3 children that have been in children's services. She has not been a mother. She doesn't know how to parent. And so what have we done? What have we done? What has the system done? That's why it's important to have a reentry coalition, because we have to work together. Thank you.
So I was just handed a note, and so I'm going to ask Captain Turner some questions so we can move this along, all right? So we can get you out of here in a timely manner. So, Captain Turner, the Franklin County Jail has taken center stage in the Stepping Up initiative. Can you tell us more about the commitment of Franklin County Jail in adopting a reentry approach to offenders suffering from mental illness?
Yes. Good afternoon, everyone. We have been very fortunate here in Franklin County. As everybody has stated, we are basically on the national scene. And as Commissioner Brown has stated earlier, it takes strong leadership. And we have had that from the commissioners as well as Kirsten here. We have been very, very involved with the Council of State Governments as well as the Justice and Mental Health Collaboration Program and the Stepping Up Initiative. So we are constantly trying to create programs for those that are incarcerated as far as reentry goes. So we currently have one specific program that we have, which is put on by the Franklin County Homeland Security and Justice Programs, and it's called the Women's Pathways to Healthy Living Program. And we have Dr. Patrice Palmer, who's part of the Homeland Security, that comes in and teaches that. What we do is we make sure that the inmates fit a certain criteria. And through the Council of State Governments, as everybody has spoke about, is recidivism. So we are trying to teach them skills. We are trying to help them with making healthy choices, the right choices. We've implemented crisis intervention training within the jail system. Normally CIT is put on by patrol officers because they're first responders out there on the street. But we do it in the jail so that we can better understand those individuals that come in, whether they are challenged through a mental disability, whether they have an addiction, whether it be alcohol or drug dependency there. So we are there to kind of recognize and work with them because, as Kirsten said in their opening argument, in their opening statement there, basically we have just become a mental health hospital. So our job has become harder. So we are trying to do things to make our officers be more compassionate, to recognize someone who is in crisis. Take the time to ask questions. Don't assume that this person is acting this way because that's their normal behavior. Find out why they are acting that way. So we are working to try to form better partnerships. I believe in communication, cooperation, and collaboration, which we have developed that with adult probation pretrial services. They come in every morning at about 5 a.m. They interview people, and they go before the judge and say this person is not a candidate to stay in jail. And the judge, there are days he may kick out 9 or 10 people, so we don't have to keep those people. They are connected with the program, whether it's Jobs and Family Services, whether it's a mental health facility, whether it be Mary Haven, Net Care, Southeast. I have Southeast coming right behind adult pretrial services. They do assessments through Southeast, which they can go back to the mental health court and tell the judge the same thing. These people do not belong in jail. We need to make other accommodations, other arrangements. So we have been very, very involved with the Stepping Up initiative. Commissioner Brown comes, participates in our programs. Most of our programs are geared toward women because where I'm at, I have a population of over 1,500 inmates. So the women are the ones that need the most attention. So we give that to them.
Great. I think we're running out of time, and you had so much valuable information, but we want to give the opportunity for someone in the audience to ask a question. You have any questions for our panel?
For people who have family members that are on the road, on the track of behaviors that you know will lead them to prison and have no indications of wanting to change their lifestyle, what suggestions might you have for them prior to them actually having to be on the other side of that, of getting out of jail in restoration? What can families do to intervene to those family members that are showing no indication of wanting to be restored? And my second question, I was very curious, you had the incident of you being in high school. What made you want to change your life to be part of what you're doing now?
Let me answer your second one first, because what changed me is that I always had this, my mother in my head, is that this is an incident. God has you. You have to move on. I remember always having strangers at our dinner table, because that's why my mother was. It was just like if someone was hungry, they were at our dinner table. I remember my father always helping people. And so it really was a fluke for me to get in criminal justice. I actually was a teacher, and I saw an ad, and I was working with people with developmental disabilities. Back in those days, they were called mental retarded. And it was a fluke. I saw an ad in the paper said work with offenders with mental retardation, and I was actually really perturbed. I just felt like, why would you incarcerate someone that has mental retardation? And from there, I came to Alvis, and they had the first program in the country that was working for with offenders with mental retardation. And from that, and worked in that program for about 2 years, and then all of a sudden, I was asked to come over and work on the criminal justice side. So I did not even want to work in the criminal justice field. And I said, well, I don't even know it. And they said, we can teach you that because of your heart. And I think that that's a lot of times that one of the things that makes us successful is that you have to have a heart for this business. That's number one. But if you don't run it as a business, you won't have a business. So that's number one. Prevention is what you're talking about with the kids and with the families.
2 minutes.
2 minutes. I'll be real quick. What we found, and the research will tell you, is that intervention is one of the best things. There are organizations in our county that work with prevention, but the prevention and interventions, and I don't know if you've seen that show on TV about interventions, that actually really works. It really works when mothers and fathers are face to face with their children and the results of their addictions. So I can talk to you a little bit more because kissing's going to kill me.
I think we accomplished it. I want to thank everyone for their attentiveness. Thank you very much, and have a great conference. And welcome to Columbus.